self-commissioned groups. We just have, so we're going to skip water users, Sky Lakes on the agenda today, so it should be pretty quick and simple. Welcome, gentlemen. Glad you're here. First time you speak, just say your name so that the recorders catch it, and I will turn it over to you.
All right, well, I'll jump in. So David Cobble, CEO of Sky Lakes Medical Center. Appreciate you guys making some time for me. It's been several months, I think, since I was last here. So just like to come periodically and just check in with you guys and let you know what's going on at Sky Lakes. And I've got a couple things we want to chat about, but always happy to entertain any questions as well that you guys might have as well. So we've got a document. I'm not going to spend any time on it. I would like to start, though. There's a little note at the bottom. It's a thank you note to you guys. Derek, in particular, you wrote a letter of support for something we were dealing with the Oregon Health Authority on very, very short notice. Truly appreciate it. It did make a difference. We were able to stop it was not to get into all the complicated issues related to Medicaid reimbursement, but it dealt with the Medicaid issue specifically. Mm-hmm. And it disadvantaged us and Providence and Asante, the only three systems in the entire state that were affected by an OHA decision. So the county commissioner, we had city respond with notes, and then numerous from the Medford area as well. Right. And so OHA backed up and rescinded the rule that they were about to implement. So thank you guys truly for helping us with that. The fight won't be over. They'll try it again, and so we'll have to keep an eye out for it, but do appreciate it. So kind of in that theme is where I wanted to kind of chat with you guys about some things that we're looking at coming down the pipe as it relates to the state legislature and things where we may at some point say, hey, could you write another letter of support or help us out with some things? So very broadly speaking, every year in healthcare is a challenge, and this year is no different for Sky Lakes. We're right up against it, just as we are every year financially. And so we've encountered a number of different headwinds this year, and I'll touch base on a couple of those things. But so we're trying to advance a couple different moves within the state legislature that would help our funding. So as you guys know, Sky Lakes is the largest employer in the county. We generate roughly $500 million of revenue, or just economic impact to the county with a fairly significant payroll for us. And then all the other resources. So obviously, I like to point out to people that Klamath County, Klamath Falls would be a vastly different place if Sky Lakes were not here. And so we recognize that. I recognize that every day as I go into work. But as that's the case, then, as we go, as our current slogan or sort of tagline is, as one we rise. Mm-hmm. And again, it's this idea that as a community, Sky Lakes benefits. As Sky Lakes improves, the community improves. And as the community improves, Sky Lakes improves. We are one community together. And so the summation of what you've got in front of you really speaks to the supporting rural hospitals. And Oregon is a very rural state, as you all know. And so Sky Lakes is the sole community provider. It's a special designation, actually, within the Medicare world. We're a sole community hospital, but our service area is huge. And we have a unique opportunity to impact this community as we do. So one of the things that's unique about Sky Lakes is our emergency department. All the emergency departments in the state, or they can apply for trauma designation. You may be familiar with that. So there's level 1, 2, and 3. So Sky Lakes is a level 3 trauma center, which is the lowest of the levels. OHSU would be a level 1. St. Charles is a level 2, for example, just so you kind of know the scope. So there's a movement supported by the Hospital Association and otherwise that would try to get the state to recognize the significance of rural hospitals, particularly the trauma centers, the way that we perform in support of this community and trying to get additional Medicaid reimbursement for that. In our case, from a government payer standpoint, about 25% of our revenue comes from Medicaid, 50% comes from Medicare, and then you toss in the military, which pays like Medicare. So basically 80% of our revenue comes from state or federal funds. And so that means then when you have things like HR 1 or OBBBA that passes and threatens Medicaid, it has a direct impact on us. Mm-hmm. And then you look at even the state, and the state's passed numerous rules or laws recently. One was the hospital staffing law that dramatically changed how we go about having to staff, and the economic penalties, civil penalties that are enforced against us if we don't meet certain criteria, to the tune of costing us, on average now, we believe it's costing us $6 million a year just to comply with that one regulatory change. Oregon paid leave, which everybody's affected by, but it certainly has affected us. It's increased our leave and backfilling positions by several percentage point, which is I could toss in probably another $4 to $6 million of economic impact to that.
Wow.
And then the state changed their charity care laws, which require us to presumptively give everybody who thinks they might qualify for charity, give them free care until proven otherwise. And there's stipulations around that. So combined, those probably are in the range of $10 to $20 million worth of negative impact on us that we've had to absorb just in the last couple of years. So as we're trying to do that, of course, nobody's paying us anymore, which again, why this comes back to a Medicaid conversation. One of the things that we're going to try to advance in this short session, and I will need your all's help with this at some point, so I'll be coming back and asking for that. And that help will, again, just be letters of support, contacting members of the legislature, anything that we can do to advocate for this. But in the state of Oregon, there are a couple, the state has designated hospitals in different groups, special designations. So they have what they call A and B hospitals, which are really the small critical access hospitals. So think Lakeview as a critical access hospital. And they have special designation that protects them from some of the overreach of some of the state legislative actions, like the hospital staffing law, and gives them some additional protection. Then you've got all the rest of us that are what they call DRG reimbursed, or it relates to our reimbursement from Medicare. But that lumps us, Sky Lakes, in the same category as an OHSU or a Legacy or Samaritan Health or some of these, or St. Charles or Asante. But we're not. We are unique. We're a sole community provider. We're bigger than a critical access hospital. We serve a vast, or in our case, it's a 10,000 square mile geography. Other similar hospitals in the area or in the state would be Bay Area Hospital in Coos Bay. Similar size, similar geography, but not, we're too big to be considered a special small hospital, and we're too small to be a big hospital. We're sort of what we like to describe as in-betweeners. There's like 3 or 4 hospitals in the state. So we want to put forward a measure that would actually give us a special designation like it does at Lakeview, so that we can avoid some of these excess costs, the regulatory burden that the state has imposed in very broad strokes across all of their hospitals in the state. But they've made an acknowledgement that a critical access hospital can't necessarily meet all the same burdens that an OHSU could. And we need to have some level of protection from that so that we can lower our operating costs and better serve the community. And so Sky Lakes, we're doing okay financially. We've got a strong balance sheet, and we manage our resources well. But this year, operating wise, it's been a really hard year, and we're looking at next budget in fiscal 26. Our budget year starts October 1, of looking at a budget shortfall that we're trying to figure out how we close, just like the county or anybody else has to solve those problems. So that's where we are, sort of, generally speaking, and why I wanted to have that conversation with you. The other thing I would point out to you as a county commission that you may never have thought of, but I think this relates to economic growth and development in our county and how we need to think about collectively how we together start to address this. But the 3 largest employers in the county, after you get Sky Lakes, is number 1. You have a school system, K through 12, plus the universities, and then the military. We all 3 share one thing in common, and it's our dependence on state and federal dollars. Yeah. So the 3 largest, you've got agriculture, but as a single employer, even as a group, they're not as large as some of the others. And then we've got small businesses. So at Sky Lakes, that means about 17% of our business has a commercial insurance, which is, and then you back out our own employees because we're self-insured from that number. It's actually about 15%. So as an economy and as a community, when your 3 largest employers, and you guys are in that mix, you could toss in city and county governments into that. So it even maybe is a little bit larger than the first 3. We've got, this I don't think is news to you, but when I started thinking about, well, how do I change the economic reality of Sky Lakes? I'm looking, well, who are the largest employers? Largest employers are government payers. And so as we think about just generally food for thought, not an ask or anything, just my own observation to say, what do we do as a county, as a community to try to generate economic growth of a commercial site or type, not necessarily just more government. I was thinking about it one day, how our tax dollars just sort of get passed around, right? So while Sky Lakes is a private employer, 80% of our revenue comes from government. So for all practical purposes, I'm paid by Uncle Sam, just like you guys are. So, and we're basically just floating dollars around our community that are really the source of funding is government. So anyway, just a thought that struck me. I thought I'd share with you guys because you may never have really put it into that context before. And that's where, as a private employer, but also one that would benefit from the economic growth of just changing our payer mix in this community, we want to be a partner with the county is how we figure out how we can do that together. So I offer that to you as well. Yeah.
Yeah.
So that's kind of my spiel for the day. We have other impacts just for your general awareness. I mentioned the One Big Beautiful Bill Act. Everybody's hair's on fire about this thing. I don't exactly know how it's going to flesh out. The governor and the state legislatures or office has given some estimates of the economic impact, and they're talking billions of dollars of impact. And then we hear trade associations, nobody's saying it's going to be an improvement in our economic reality. But the degree to what the impact will be and the timing of it, fiscal 2026 for us, there's really not a lot of change. If you've looked at the legislation, there's not a lot that happens in this next fiscal year.
Right.
It's fiscal 27 and beyond. So we have to get through a midterm election, see if there's any changes that occur after that. But it will be a challenge for us. And so I'll keep you guys updated as we go through it ourselves, just so that we have to address this as a community as much as we can, because it will be a challenge for us. Some of the changes in the legislation honestly make sense from my perspective as an individual, but I can't ignore the economic impacts that potentially bring. We are facing increasing labor costs, as I've alluded to, just by the hospital staffing law, but also union contracts. So in another year, we'll be renegotiating our nursing contract. We are downstream from what happens first in Portland, then goes to Bend, then to Medford, and then to us, sort of the way the cascade of contracts falls. So everybody's reacting first to what happens in Portland, and then Bend tries to remain competitive with Portland, but we draw, and then Medford needs to remain competitive with Bend. And so we're all drawing from the same South Central Oregon labor pool. So while I don't think, and it doesn't cost as much, fortunately, to live in Klamath Falls, the economic reality is the nursing staff and others will say, well, I can go get a job in Bend, whether they actually would or not, or if they couldn't buy a house if they did. But that affects us. So, and then last point, and then glad to answer any questions you have about anything else on this or any other topics that you'd like to ask about. We are seeing increase in supply cost and inflation, as you guys, I'm sure, in county services and otherwise are. It's inflationary, it's tariffs related, it's our drug costs are going up considerably due to some of the challenges with tariffs. So not anything for you to do, just, sometimes it's good to commiserate with others that are dealing with the same challenges. So
Yes, it is.
Yeah. So again, thank you for your support earlier, and we'll appreciate any support you guys have to offer as we look forward to the next short session.
Of course. And you have it, whether it's a letter or a phone call or a trip.
Yeah, or all the above.
So let me know. I'm happy to dive in where necessary. It's interesting. I was having a conversation with a group that came and sat down with me, I don't know, a couple of weeks ago. And I'm getting to a point. They were asking me about Medicaid and the Big Beautiful Bill, and they're asking me all these questions. I said, I don't know. When it comes to like my lane is natural resources. There we can talk all day long. Federal payments to counties, how we manage public lands, all of that type of stuff. I'm your guy, but when it comes to Medicaid, I don't know. But the good news is we have experts in our community that'll let me know what I need to know when I need to know it. And so thank you for coming in and kind of giving us a quick briefing, and I know you'll keep us abreast.
Yeah, absolutely. And anytime, if you have questions at any other time, you can reach out as well. But
of course,
trying to keep like I said, we're all in this sort of challenge together. And I personally, but certainly as a health system, we really want this community to thrive. It's in our vision statement, which I shared with you guys last time we met about it, creating a vibrant and thriving community. And we're committed to that idea as well. So anything we can do to partner to make that happen is appreciated.
Thank you, Commissioner. Yeah.
Thank you. Appreciate it.
Yeah.
All right. Yeah, no other questions. Just keep me posted. Keep obviously the board posted, but let me know where I can assist.
All right, will do.
Before we end, Chair, if I might, I'm Dave Hensley for the record. I'm with United Strategies and Consulting. We're a government affairs firm that advocates and lobbies for rural health care, and we're a champion for Sky Lakes Medical Center and love to fight for them whenever we can. I just want to add one quick thing. Mr. Cobble and his executive team are starting to identify their legislative priorities coming into the next short session. So I anticipate that our next meeting that we have with you going into the winter will be all about our legislative priorities. We'll develop another one pager for you, and Mr. Cobble will outline where we're going to go with the next short session. Number one on our list is clearly going to be the special designation. We wanted to give you that a little bit early, but as we identify our other legislative priorities, we'll make sure that you're on board. You know what those are. As Mr. Cobble pointed out, thank you so much for continuing to advocate for Sky Lakes. Sky Lakes is, without Sky Lakes, this community would start to fall apart. Let's just be honest. Dave outlined it. It's one of it is our biggest employer and our most significant economic impact in Klamath County, and we need to do everything that we can to continue to support them and make sure that Sky Lakes is successful. We'll continue to have conversations about the medical school and things like that as they come up, and we'll keep you abreast of what we're working on. But
Yeah, really.
yeah, we're still very hopeful and very optimistic that.
Yeah, if I can, I'll be happy to go
I'd
on medical
love
school. I wasn't
to
even
touch
thinking
on
about that, although it is on my mind quite a bit. So we being OIT and Sky Lakes right now, we are moving forward. The university is going to move forward with a planning study and looking at what's all involved in creating a medical school. We've been public about saying it'll be an osteopathic medical school, which is, if you're not familiar, it's a little different than OHSU is an allopathic medical school. And so a DO program is what we're talking about. We're really excited about it. The university's made some steps forward. It's a big lift. We've laid out sort of a high-level timeline to say how long would it take before we'd see our first students from just knowing the anatomy, if you will, of building a medical school. In fall of 2031 would be what we're hoping would be on the most optimistic, that we would have our first class of medical students at OIT. So sounds like a long way off, but it's not that far.
Yeah.
And the amount it would just be a huge benefit to the community and to OIT. And if Dr. Naganathan were here, he'd certainly be able to speak to that very directly as well. And he and I are both committed to this and very passionate about it. But it will deliver such an impact to rural health and to providing primary care physicians and others, not just primary care, but physicians that are trained in a rural setting, that we know that if you're trained in a rural community, you're 5 times more likely to practice in a rural community following graduation. And we see that through our residency program today. So it's a long road ahead. At some point, it might be worthwhile if maybe we'll come back in another time and Dr. Naganathan and I can come talk to you more about it.
Wonderful. Yeah.
Because it's really an important initiative for the university, for Sky Lakes, and then for rural Oregon, not just Klamath Falls. We become the beneficiary of it. Medford has an interest in starting a medical school as well, but we're well ahead of them. And I think we've got more support even at the state level. So that'll be another ask. Perhaps at some point we're working on an idea at the state legislature to see if we can gain some additional state support, not even economic support at this point, but even just the state's stamp of approval on the work that we're setting out to accomplish. So
Yeah.
more to come, but it's a super exciting project. We would love to see it happen here. It would really change our community for the better.
Yes, it would. I don't think people realize what it means to have a local community hospital and how they're disappearing across the country, right? And more in favor of these large multi-city conglomerates almost, where medicine becomes so much more of a business with less of a local personal touch. We're very fortunate to be able to preserve Sky Lakes.
Well, I thank you. I agree. It's what brought me here, having been in those large multi-state, large national systems as well. And there is a difference. I point out to people that I talked about the $500 million of economic impact, but that's money that we are putting right back in this community. It's not some portion of it being taken away and sent to some other larger system where it gets redistributed to some other city and some other state. So 100% of everything that we generate stays in this community. If we buy a piece of equipment, it's being installed here and the capital is being invested here, or we have to replace an air handler. We're using local resources. If we build a building, do any sort of construction, we're using local resources to do that. We've got the building downtown. You may be familiar with the old DHS building. Well, actually, I know you are.
Yep.
And so hopefully we've already started demolition in that building, but we're trying to get it open by the spring for physical therapy.
Yeah.
And that'll we're estimating 200 to 300 patients a day coming to that clinic, which are then circulating downtown Klamath Falls, visiting restaurants and shopping, and just the energy that comes from having traffic. Our Healthy Klamath office is now at the 500 Main Street building that we acquired, along with our foundation is now in that space. And so again, just wanting to help revitalize some downtown activities just by making investments in downtown. But all of those things stay here in Klamath Falls, stay here in Klamath County.
That project is tremendous value add for the downtown core.
Yeah.
So I was going to ask, how's housing impacting you with your workforce, things like that?
We've recruited probably in the last year, we've recruited 24 new physicians and nurse practitioners, or APPs, as we call them, advanced practice providers. And we haven't learned of anybody that's come into town and then said, well, I'm going to rescind my offer or my acceptance because I can't find a place to live.
Okay, good.
Now, when I look at it, depending on your price point, there is inventory right now in Klamath Falls. Some of it's old and some of it may not be in the areas where you would perhaps choose to live, but I haven't heard that as a specific issue. We're recruiting heavily in nursing, continue to recruit heavily in nursing. We're getting a lot of the students out of KCC and more out of OIT. So if they're young students, they've already been here for a while and they already have a place. Now it's, again, do they have inventory to move up? If they're renting, can they get into a home, and what does that begin to look like? So there is still very much a need. If we do the medical school, or not if, I shouldn't say if, when we do the medical school, depending on the class size, that will create a demand for temporary, I would say more high density, newer apartment housing or condos or something of that nature. I think for me personally, that's where the need is. There's need for single family homes as well, so that, you have room to grow in the market. But the limiting factor for a medical school on the housing side might be just availability. If we brought in, say we had a class size the first year of 25 students, well, that's likely 25 students with significant others. And so that's 20, it doesn't sound like a lot, but if you go then doubled it the next year, or I don't know what, we haven't figured out what our class size will be, but let's just say ultimately it gets to 50. Well, then by the time you have 4 years of medical students in, that's 200 students that need housing, and they're not looking for dormitory. They're looking for something, most likely a 2 to 3 bedroom size home. And if they start a family, which sometimes they do while they're in medical school, then it's more than a 2 bedroom. You think they need at least one room for an office to study in, or, something like that. So that's where we're going to be short on the inventory side, is once we get. So I think as we do some of our planning and we think about the medical school as it moves forward, probably a conversation needs to be had with county and city zoning and planning, and thinking about how we might plan for some of that, and where, if there are other investors or grants or other resources that we can bring to help with that.
Absolutely. As you mentioned, 6 years is not that long.
No.
You're talking about having to provide 200 additional doors to satisfy that need. Yeah, it's not a long time.
No. And, it's to make it attractive for these students who are going to have choices as to where they want to go to medical school. We need to be mindful of that as well. We really need to be able to sell a program for the beauty of the region, the support from the community, support from the hospital and otherwise. But then people want to know they've got a nice place to live with community resources and other things, which ties right back to that economic development conversation. Assuming that some of them do come with spouses or significant others, they're likely going to be looking for work too. Now, some of them may be medical and we'll absorb some of that, but you might have somebody who's in an entirely different field. And that could determine whether or not they're willing to come to a rural community to study medicine.
Great. All right. Yeah, well, covered a bunch of stuff.
We could sit for an hour.
Oh man. How's the KCC nursing program? Is it making a dent in the nursing
absolutely.
need?
Yeah. They have a really good, in fact, they're in the top in the state among the nurses that pass their national exams on first pass. Yeah, they do an excellent job training the nurses.
Well, that's a story.
And so we recruit almost, they have a deal with Lakeview. So I think 1 or 2 students goes back to Lakeview every year, but otherwise we have near 100% retention of all of the students at Sky Lakes or in the community.
That's incredible.
And we're pulling more out of OHSU, OIT now as well, because of course they admit students from across the state. But we're successfully recruiting now from students that maybe lived in some other part of Oregon, and now they've gotten to where they like Klamath Falls, they like Sky Lakes, and they want to stay. We're now actually recruiting out of Northern California and other states as well, successfully, because people come here and they say, you know what? I say to people all the time, if you can get them here, if they will physically get here, they like it. It's sometimes getting over the mental, well, there's not an airport, I've got to drive. And when well, so what? If you lived in Atlanta, you got to drive in traffic and you're no closer to the airport than you are here. And at least you got a pretty drive.
Yeah.
So, but once they physically get here and they realize the presence of all that we have in this community, it's not a hard sell.
Well,
So-
I'll add to that too, David. You're also bringing kids back.
Mhm. Yeah. Well, Dave's daughter's back.
Yeah. It's like,
We know that to be true.
Yeah.
So you're talking about recruiting out of California, which is true, but we're also seeing that kids are returning to Klamath that finished their pre-med at Oregon Tech and went on. And so that's very exciting too.
Yeah. And we're recruiting, a lot of the physicians we're recruiting are young. So they're finishing their residencies and fellowships and they're coming here and they'll be starting families if they don't arrive with children. And they generally, which, that backs the Oregon paid leave. That applies to doctors too. So we'll have some that will have kids and they'll take their leave, which is great. They get to spend time with the newborn. But the important part of that, the most important part is we're growing young families here. And that creates a different feel for our community, which is pretty awesome.
Agreed.
that's huge, actually. Yeah.
So,
That was always the goal when I started this thing. So it's
Yeah.
nice to see it starting.
yeah, so we got to keep it going.
Yeah.
And then it moves to retention. After somebody's been here 3 or 4 years, do they feel like there still is an opportunity to grow professionally? Their kids are being well cared for, schools, that sort of thing become an issue at that point then too. But yeah, we're having some success recruiting and retaining. We've got some families, got 3 doctors off the top of my head that are either on maternity leave or have just come back. So we're trying to increase the population one family at a time here in Klamath Falls.
I like that.
Yeah.
Love the babies. All right. Well, anything else? No, we'll go ahead and wrap it up. Thanks so
All right,
much.
thank you guys. I appreciate your time.
We'll adjourn at 3:27.